A study in the United Kingdom has said that obesity should in fact be considered as a disease rather than as a lifestyle sort of a situation. Now, the doctor from the Royal College of Physicians says that the way we think about obesity could actually help the health sector find ways to address the problem and also help those with serious obesity to receive special care. Now, according to the statistics that are available, 1 in 4 adults in the United Kingdom is considered to be obese, although this could be a little misleading because obesity is defined in terms of body mass index. And roughly about 20% of the children in the age group of about 10 to 11 are considered to be overweight. Outlining a plan to reclassify obesity as a disease, Professor Andrew Goddard, the president of the Royal College of Physicians, has said, and I quote, "It is important to the health of the nation that we remove the stigma that is associated with obesity and therefore call it a disease." He further says, and I again quote, "It's not a lifestyle choice that is caused by individual greed, but rather a disease that is caused due to health inequalities, genetic influences and also social factors." But not everyone is convinced that recognizing obesity as a disease is the right thing to do. Some health experts feel that obesity is actually a condition which is dependent on the environment, and it is definitely not a disease because it does not necessarily hamper the way that a person can live. Now, various surveys have revealed that children in the United Kingdom consume more sugar by the age of 10 than the maximum amount that is recommended for an 18-year-old. Now, health officials in the United Kingdom are pushing for a pudding tax, which will cover cakes, biscuits, sweets and other sugary snacks in order to tackle the country's sweet tooth that is reportedly fueling the crisis. Now, pudding tax could work in a similar way, such as the sugar tax, which is already applied on soft drinks, which was introduced last year with a levy on drinks which have a high level of added sugar. Now, the food industry has always been made to cut sugar content in common foods to a fifth by the year 2020. The categories include breakfast cereals, yogurt, cakes, biscuits, sweets, chocolate, ice cream and sweet spreads. So these items will have to cut down their sugar content by as much and reduce it to as much as about 20%. Now, UK's national data shows that the average child in the United Kingdom consumes the equivalent of 8 excess sugar cubes every single day, which is around 2,800 extra cubes per year, with the average child consuming at least 138 kilograms of sugar by the age of 10. Now, let's compare the sugar eating habits across the world. Americans consume the most amount of sugar in a day in the world. Germany comes a close second. The United Kingdom is 4th on the list, where an individual consumes much more than the limit prescribed by the World Health Organization. Now, contrast this with India, China, Russia and Brazil, who are amongst the few nations where the average sugar intake is actually less than the recommended daily intake. But remember, all of this is weighted average, and there could be several segments and pockets within population in these countries who could in fact be consuming more sugar than what is recommended.
This comes from, as you've just said, the Royal College of Physicians, who want this to be classified as a disease, as a chronic illness, as opposed to a lifestyle choice which is caused by things like overeating or not exercising enough. And really, there are two arguments to this. There are many of those in the industry who agree with this, who believe that what this would lead to, therefore, is reducing the stigma against those who are obese and, of course, giving those with obesity the treatment and special care that is needed, that it could lead to that. There are others, however, who simply argue that there are dangers in classifying obesity as a disease, because essentially obesity is an outcome of an unhealthy lifestyle. That is their argument. But of course, the Royal College of Physicians saying that there are 3 major factors that contribute to a person becoming obese, and those are health inequalities, genetic influences and social factors. factors. So essentially the environment in which someone grows up in contributes to potentially them becoming obese. And we also know, of course, that there has been research to indicate that over 100 DNA shows that some people are more prone to obesity than others. So there's an awful lot of scientific research behind what the Royal College of Physicians are suggesting on this one.